going to look at our heart. So firstly, we're going to explain. I'm going to explain the structure and function of the heart. Okay. Then we're going to look at the blood. Definitely, heart is an organ that pumps blood. So we can divide blood into two types. Okay? Generally, okay. So the first one is oxygenation, and another one is deoxygenation. Yes. Okay, everyone. Okay. So basically, the concept is you have already misconception. Yeah. So oxygenated blood also got carbon dioxide. So this is how the surgeon perform the surgery. I've shown you the latest technology recently only, where we use we create a machine that can still the heart is still beating. Yeah? So it's some sort of like a fresh heart, yeah? Like a fresh heart. But if you go for the prior technology, is you put the heart inside the eyes. Yeah? The surgery must be done within 6 hours. Yeah? After they take the heart from the donor. So it's not. This is only recently the technology. Eh? So bear in mind, we got this technology. I'm not sure whether the technology is here. Yeah. And this is the standard. The bone here in the middle of the chest and the heart bone there. And this is the heart. Yeah. Okay. So this is the structure of the heart. You have to remember each part of this heart. And we also have atrioventricular valve here and here. Okay. And then we have right ventricle. So our heart is located. Our heart is located or are located? Located. That means you have to heart more than one heart. Right? So obviously you can feel it. Okay? That is in a rheumatic cycle. Contract, relax, contract, relax, contract, relax, contract. What happened? Contract and then no relax. Relax, no contract. There will be no blood circulation. Alright? So when contract, it pumps blood.